Good evening, Agent. For some reason, I didn't think I'd see you back here so soon. But you have been in quite a few times lately. I'm starting to think you're getting injured just so you can come see me. And what's this now? It seems you've taken a bit of a spill. What, you didn't think your chain of command would tell me? They tell me everything. It's all right here. So, they suspect you may have hit your head. So we will be performing a full cranial nerve exam before you'll be allowed to go back out into the field. I do hope you understand that. It is a necessary precaution. Yes, I understand. Well, perhaps arriving in the markets of Marrakesh by jetpack wasn't the brightest idea you've ever had. Okay, well, regardless of what your opinion on that might be, I still have to perform a cranial nerve exam, okay? It's nothing serious, it's nothing painful, it's just a series of observations and assessments on the function of your cranial nerves, of which there are 12. So, oh, wait a minute now. I missed your last exam. You had an appointment with the other medical officer? And they didn't perform a cranial exam on you, even though you decided to go parasailing into the casino in Monaco? Well, I guess I'll be having a chat with the big man who signs your paycheck after all. Have you tried staying on the ground? I find it's a lot easier to avoid falling out of the air if you're not in it. Agent, have you had any changes in your sense of taste or smell over the last couple of days? So bananas still taste like bananas, chocolate still tastes like chocolate, etc. Okay, so I won't worry about testing those. I do have a few cards, little scratch and sniff things that we could use, but I think we'll avoid that. It's rather childish. I'm just going to make sure that you're seated and comfortable. I'll get you to sit up straight for me, okay? Now I'm just going to start by palpating your head, okay? I'm just going to touch you lightly there, the top and the back of your head and around the back of your neck. Any pain, sensitivity, strange sensations there along the front of your forehead, just like that. No issues. Okay. So I'm just going to look at your pupils. I'm looking for size, making sure they're the same size. So my thumbs are on your eyelids. I'm just going to pull up and have a look. The shape and size of your pupils. Now I don't see any issues there. Your pupils look fine. So I'm just going to grab my little pen light. We're going to do a light reflex test. I'm sure you've had this before. This isn't your first suspected concussion, so just grab my light here. I'm just going to bring that right into your field of vision. I'll get you to look straight at me. Okay. Keep looking at me. Very good. One more time, okay? Keep looking at me. And one last one. Okay, there we go. So now we're going to do the swinging light reflex, okay? So I'm going to be moving from one side to the other. I want you to keep looking straight ahead again. You're just going to see the light move in a bigger field here. Okay, still just checking your pupils. Side to the side one more time. I gotta look at both of them. And there we go. And the other one. Perfect. Do you remember hitting your head at all? Or is it just suspected? Since it was a jetpack. Well, you fell from 25 feet. So we kind of have to suspect a head injury. I would suspect anyone who thinks that jetpacking into the markets of Marrakesh is a good idea. I would suspect that they have a head injury to begin with. So we probably should have done this test sooner than later. Now I want you to keep looking straight at me, okay? I'm going to be looking in the inside of your eye, okay? So I have a little light here, and I'm going to have to get really close to your face, if that's okay. I promise I showered today, okay? So in here we go. There's one eye. I'm just going to look. And we're just looking at the back, inspecting the retina. We're looking at the optic nerve. Okay, perfect. And the other one. So keep looking straight ahead, just behind me, through my head. Okay? And there we go. Perfect. No issues there. Not that I'm surprised. I know you're in good health, despite the odds. Okay. So now let's just take a look at some field of vision. We're going to take a look at your central visual fields. So I'm going to get you to cover your right eye and look at me. Look straight at me. Is any part of my face blurry? No. So it's exactly the same as when you had both eyes open. Okay, perfect. And now you can take that hand off and you can cover your left eye. Same thing. Did anything go blurry when you covered your eye? No change? Okay, just give me a moment. I'm going to write this down, okay? I am surprised that this is your first cranial nerve exam. Okay, so no abnormalities so far. Okay, so no pain around your skull when we did the palpation. Your light tests were okay, your pupils look fine. We did the central visual fields as well, which was fine. So we are going to test your peripheral visual fields as well. The old, how many fingers am I holding up test. Okay. So now we're going to be testing your peripheral vision. And for this short little test, I just want you to keep looking straight ahead, okay? No movement to the sides at all, only straight ahead. So pretend you're looking straight through my skull onto the back wall, okay? You're just going to see my hands come up to the side, right up to the top, and I want you to tell me how many fingers I'm holding up, okay? Okay. Great. Alrighty. I'm just going to write that down. You have passed so far. You're right. Okay. The central and peripheral visual field tests were normal. Okay. So just a quick visual acuity check. You've done these before, I know, when you got fitted for those special goggles. You've seen this chart before, I'm sure. Can you read what that says? Perfect. The bottom line. You can read the bottom line. What does it say? Great. 2020. No change. No change. Okay. I'm going to get you to look at my finger. Okay. Just keep your vision right here, centered on my finger, and follow my finger as it moves. Okay. And over. Great. two eyes to look at, you know. Here we go. Great. Smooth pursuit. Normal. So now we're going to be testing your reflexive and volitional saccades. So I want you to stay focused on my nose. Keep your vision right here until I tell you otherwise. I'm going to be bringing my hands up into your peripherals. Now as soon as my left hand starts to move, I want you to move your eyes to it and then back to my nose. And same with the right, okay? Okay, now I want you to move your eyes all the way over to one side as far as you can. Smoothly, yep, and then back to center, and all the way over to the other side, and back to center. Look all the way up for me. Good, and I'm just going to put my hands on your eyelids, and I want you to look all the way down. Any discomfort there? Okay, perfect. So that was normal. So our next step is to test sensory function in your face. Okay, so we're going to be doing that in two different ways. One with just a light touch sensation, the other with a little bit more of a disruptive sensation, but it won't be painful. Okay? So we're going to be starting with the light touch sensation. I have this little cotton ball. I'm going to touch certain areas of your face. I'm going to use the same amount of pressure for each. And I just want you to let me know if for some reason you don't feel the sensation of the cotton ball, or if it feels vastly different at all. Okay? So right up here, one side. Okay, down a little bit. And at the jaw, you felt all of those. Okay. We'll just do the other side here. Okay, down at the jaw again. And how was that? Just light touch, no pain. You felt all of them, and none of them felt different. Excellent. Okay. So we'll be moving on to the pinprick sensation, okay? A little bit uncomfortable, but it is necessary. It won't be painful at all. I'm just very lightly going to touch you in those same places with the pin. Yes, the pointy end. I just want you to let me know if for some reason you don't feel it, or if it feels vastly different in any of those areas, okay? So again, just up at the top here on one side. You felt that. Okay. And here in the middle. Okay. And at the jaw. Perfect. Okay. In the middle. And at the jaw. Anything? You felt them all? None of them were different? Okay. I'll get this out of your sight. I know you're not good with needles. I read your file before you came in. I do that with all of the patients. I know more about you than you think. I know more about all the agents than you think. It's kind of my job. Okay. So next I'm going to be testing your muscles of mastication. That's the ones you chew with. Okay? The masseter, the temporalis, and the pterygoid. All right? I'm just going to be palpating your face gently, so you'll feel my hands, just looking for any sort of abnormalities. Wait and let me know if you feel any pain. Okay? If anything feels any different from side to side, you just let me know. All good? Okay, so I'm going to get you to clench your jaw for me. My hands are on the side of your face. Grit your teeth, clench your jaw, and let go. And again, grit your teeth, clench your jaw, and let go. Okay, my hand is underneath of your chin. I want you to try to open your mouth. Okay, now let your jaw slacken. I want you to try and close your mouth. Perfect. Okay. The muscles of mastication. Sounds like weapons of mass destruction, doesn't it? So while I'm still right here, I'm just going to feel around the muscles in your hairline and your forehead. Just want you to let me know if you feel anything painful, anything feels swollen. Okay, down the bridge of your nose here. Nothing? Anything feel different from side to side at all? Okay, I want you to scrunch your forehead up. Perfect. Now, shut your eyes really tight. Okay, I want you to keep your eyes shut. You're just going to feel my thumbs come over your eyelids. Okay, now I want you to try and open your eyes against my thumbs. Great. Now big smile. Show me your teeth. Awesome. And then puff your cheeks full of air. Great. Everything's normal so far. Just give me 1 second. I'm going to write that down. Okay. Everything's normal. You still look like a monkey when you do this. As does everyone. That's normal. So we're going to do just a very, very quick hearing test. Have you noticed any difference in your hearing since the jetpack incident? So both ears hear the same. There's no change there. Any tinnitus or ringing in your ears or strange sensations inside your ears or anything like that? Okay, so my hands are going to come up beside your ears. Keep looking directly at me, okay? And I want you to tell me if you hear any soft sounds in either of your ears and which one, okay? Anything? Okay. Great. Awesome. So now we're going to move down into the mouth and neck area. I'll get you to just open your mouth for me. It's okay if your tongue twitches just a little bit. I'm just checking for some symmetry in the back of your throat. I'm just going to grab my light, okay? Your mouth is a bit of a dark cavern. Okay. Open wide. I could never be a dentist. I despise mouths, honestly. Okay. And no issues swallowing or anything like that. Everything seems to be okay. Yeah, you are talking normally to me, so I don't see any changes in speech patterns at all. Cracked teeth, tooth pain, jaw pain, anything like that. Nothing. Awesome. That's good news. Absence of symptoms is generally good. Generally. Okay. So we're going to be testing the strength of your neck muscles. All right. So the trapezius here along the shoulders and down the upper back, and the sternocleidomastoid that runs right here on either side. All right. So I'm just going to put my hand up against your head. And I want you to push into my hand. Resist my hand. Okay. And the other side. Resist my hand. Awesome. My hand's going to come around the back of your head. I want you to push into my hand again. Great. And other side. Just push into my hand. Awesome. Now shrug your shoulders up to your ears. And down. As far as you can. Lots of room. Okay, and then roll your shoulders forward, up, and back. Any pain? Abnormal pain? A lot of people have neck pain. Okay, so no change since the jetpack incident. Alrighty, great. So we have, I think, one more test to do. I'm just going to write down your results real quick. Let me just write this down real quick before we do our last test there. So everything has been normal so far. I don't expect we're going to have any issues with the last test, but we're going to do it anyway. Can you just open your mouth again for me? No, keep it open. It's funny. I really do find it funny. You agents are always objecting to orders given to you by the big man in the tower. But as soon as I tell you to do anything, you'll just do it. Perhaps I should be giving you orders. You can close your mouth. It's all right. Okay. So last but not least, we're just going to quickly check your tongue wagging abilities, which I can already tell are adequately practiced. But I'll just get you to open your mouth again. I need you to this time. Yep. And all I'm doing is looking for any sort of asymmetry with your tongue. Okay, can you stick your tongue out at me? And I move side to side. Great. So I want you to put your tongue in your cheek. And I'm just going to push on it. I want you to resist my hand. Okay. And your tongue in the other cheek and push against my hand. Awesome. So everything's normal. That is the end of the cranial nerve exam. Nothing painful, you know. Just it's a long test, but it's nothing complicated or anything. So I will let the big man in the tower know that you'll be resuming field work immediately. Might I suggest, however, that you try, at least for the near future, to keep your boots on the ground. You're a lot more prone to injury when you're just floating around in the air. Okay? Well, fine, then. I will write you a chit, and then you won't be able to do any sort of flying. No jetpack, no parasailing, no skydiving. Is that what you want? Okay, so I will let him know. If you do experience any issues, any changes in vision or taste or smell or hearing, then I need you to come let me know immediately, okay? And we will try and figure out what's going on. So I will send the results up to the big guy in the tower. And I'd like you to try to stay out of my office for at least a week this time. All right? Okay. It was wonderful to see you again, Agent. Keep your boots on the ground.